our teams to be working on across our jurisdictions as we were talking about and looking at the implementation that needs to happen. So just want to open it up to folks to, what are some of the things that you feel is most important, either the things that you saw on the boards today or things that you didn't see that you want to make sure that we're focusing on? You need to figure out where your dots are. I have to go back and forth with my dog. Do you want to start, Laura?
Oh, I can. I'm just going to wing it now because I'm trying to remember what primarily what comes to mind for me is that I know that my number one concern is someone who has served the house's population for 10 years. That is what I've done basically the entirety of my social work career. That is what I do right now in terms of supporting a number of social workers and nurses that do this work. And I am concerned about not thinking more thoughtfully and thoroughly about pathways for folks out of shelter or alternatives to shelter. And so I would really like us to kind of have a conversation that really sort of looks at the totality of our system and all of the mechanisms and means in which individuals get housed. And one of the primary things that my team does at the hospital in trying to figure out in a short period of time how to get folks navigated into permanent supported housing is what is an individual coming with and presenting with, and what system might I be able to navigate them through. Sometimes it's easy and shelter makes sense, and shelter ends up being a lot of times our default. But if we can get someone into permanent supportive housing or housing, that is the thing that's going to have the long-term outcome, 100%, and that's demonstrated time after time. And so what that looks like sometimes is identifying someone who's, chronically ill, who may have, who's not demonstrating ability to care for themselves. Can they be pathwayed through long-term care? So are we looking at, and I don't see a lot of conversations about those other systems that are pathways for folks to get housing, and then how are we making sure that if an individual is navigating through shelter, that those shelter systems are thoroughly staffed with staff that understand the nuances of navigating through different systems and identifying those needs for unique individuals, where we can plug and play people through different mechanisms around how we might get them housed. Whether that's someone who is identifying that they want to disrupt their use, and so they're saying, I will go to residential, and then my thought is, how is that system operating and functioning now? What is their capacity in order to get folks housed? So I really think, I just wanted to make sure that there is space for thinking about and identifying. I think it would be helpful for folks who may not have complete understanding or knowledge of all the different means in which an individual can become housed, that we explore and look at those systems that we currently have, and then how are those agencies that navigate those people, how are those agencies operating? Are those agencies fully staffed? Are they supported in the ways that they need to be in order to ensure that they can take the capacity needed to filter the number of folks through those systems to get them housed? So that's one thing in looking all that to me that was sort of a little bit of a missing piece is really, again, not discounting and wanting to have a grasp. I want everyone to have a thorough grasp and understanding of all the pathways in which folks in the community utilize to get somebody off the street. And sometimes that isn't always shelter, and sometimes that's shelter to something else. And I know this got mentioned, I think, a little bit the last time we met. I do transitional care, so I feel very strongly that that's an important component, and that's been really effective for me. I also recognize and understand that transitional care isn't the end-all be-all, and that may not be an appropriate pathway. I think sometimes folks get thinking that it needs to be linear, like a person needs to go from shelter to transitional care to permanent supported housing. I just think that we need to think about the fact that there may be skip steps, or that may look differently for different people, and then what does, again, that breadth look like, and are we making sure that we're thinking about bolstering those systems to do that work? Behavioral health is a great example, which is all over the place on here, and is a very significantly troubled system that we have, unfortunately, in our state of Oregon. But that is also a major mechanism in which that folks get supported through their needs. Also identifying, again, that's listed on here, what are the barriers to folks navigating through supported housing, and why aren't they successful in staying that, especially when we're talking about the rising acuity that we're seeing in our community, and are we ensuring, again, that we're talking about building funding and moving things to support the people that are doing that work and the capacity that's needed to keep people in those housing. So that's to me overarching. When I'm looking at all this, I just feel like I would love a conversation, a roadmap if we could, or something to that effect that talks about and looks at all of these systems that are at play that aren't particularly identified in this space, that is part of a conversation around how do we address and navigate for folks through homelessness.
Thank you. Thanks, Laura. Who else? Here's Noble.
I'll go. Effectively, I think the permanent supportive housing is absolutely, in my opinion, the highest priority we have. Part of that's because the timing it takes to produce it. I'm confident we've got a lot of bright people sitting at this table, a lot of bright, intelligent people sitting in this room working on these efforts. I'm confident we're going to figure out the pathways, we're going to figure out the service delivery, we're going to figure it out. But we can figure all of that out and still not have, the exit from our shelter systems, from our hospitals and healthcare systems into something that is permanent to semi-permanent for housing. And if we don't figure that out, we've had the 3 service providers here about a month and a half ago who said the exact same thing. Eco Northwest, homelessness is a housing problem. Pew Research, homelessness is a housing problem. Everybody's saying the same thing. And if we don't solve that, it doesn't matter what we do down the line, we are not going to solve the ultimate problem. Now, again, it's not to say that we don't have priorities in regards to shelter beds. It's not saying we don't have priorities in regards to behavioral health services. Those are priorities, and we've got to get those figured out. But if we don't start now, with the highest priority being how do we ensure, and I said permanent supportive housing, but it's really going to be housing inventory across all the available opportunities for housing. Because if we don't, and this is something we heard from Pew Research Center, if we don't actually have the inventories across all of the available housing components and sections, you're not going to have the people moving up and out as they become, as they leverage the work source system and get more education and retraining there. They're not going to be able to move up through the system, which is going to clog some of our highly affordable, deeply affordable, and affordable units and opportunities. We've got to have that ability for folks to move up and move out. And so from where I sit, that to me is of the highest priority, because if we don't start now, we are not actually going to have the solutions in 2 to 3 years when we absolutely get our systems so dialed in that we've got the throughput, we've got all of our mental health and behavioral health solutions in place. All of these things are working well. But if we don't start right now, if we don't start today, similar to what the city of Portland is doing with their SDCs, then we are going to be challenged right at the time that we need to exit folks from the programs that we now are doing extremely well.
Thank you,
Well, first of all, Jillian, I appreciate the focus on reducing and removing and isolating our efforts on some key items, outcomes, and KPIs. It's a great exercise for that. To what Mayor Stowell noted, the council on Wednesday voted unanimously to reduce SDC fees on all new construction for the first 5,000 homes. And so that is tens of millions of dollars of reduction in fees to flood the market with 5,000 homes, market rate homes fast. And so that is right, that is what we do. The other part of that I added was, at Portland, we're having a tremendous amount of success with reunification and diversion. We just helped a person reconnect with his brother in Eugene. I really would like us to say and center everything in this program is asking a person, if you're not from our community, can we connect you with housing with your loved one? And the least expensive cost and the most immediate and safe form of housing is with a loved one. And if it's in a different community, it takes the pressure off of our community so we can unlock the system. And we're having a lot of success with that. So I would invite us, everything we do is to ask a person, where are you from? Can I help you get back home? Because we see a tremendous amount of souls in Portland that aren't from here, and that it should be our most immediate type of. So for $30 yesterday, we housed somebody in Eugene, taking the pressure off who was previously on our street just a few hours ago. And then I want to focus on the first item. And I've been very clear in the 8 months we've been here. We have to focus on
the back end, which is housing, but we can't take our eye off of the front end, which is shelter. We can't let our streets be a destination ever, full stop. And so therefore, I've been very consistent. We have got to flood the market with shelter so we can provide just basic life-saving care to address the crisis. That's creating burdens on our public safety system and our ability to revitalize our communities. So those, you'll see a lot of stars over on the first section, by the way.
Thank you, Mayor. Anna or Peter?
Yeah. I think also want to recognize that as the taxpayer person voting on this committee and living out in East County, I was driving in for like 45 minutes. You know that drive.
Oh yeah, I made it this morning.
I know, I'm shocked I wasn't late. But I just, I think what I'm holding true for my role too is just recognizing that HRAP is kind of grounded in regional and a housing first framework. And I think that's really important to hang on to what the voters approved in that measure. I think that I want to emphasize that accountability for public dollars for me is investing in strategies that reduce homelessness, not just moves it. And I think that's something that I really was holding as I was looking at, in East County, I don't know. What I hear is shelter really isn't the strongest need that it really is. I think what Mayor had just shared, and I believe in those preventative kind of upstream intervention services to keep folks from finding themselves living outside. I think that the high visibility areas like downtown Portland, that a strategy that really centers shelters and beds could be a solution, but I think out in East County and in Gresham that really looks very different. And we should be really thinking about those needs out there as well. And so I think what's more rental assistance, other measures of permanent supportive housing. So that's just something that I really wanted to elevate as something I'm thinking about as I run this exercise.
Thank you, Chair. Going back to, I thought it was great to see what the key roles and responsibilities are for the SOC and setting strategy and key performance indicators. I feel like we've been in that conversation a lot in this room, and I'd really like to be moving to the other bullets, frankly, because I fall back. I think what you've done is fantastic instead of kind of aligning it, making it clear, and maybe removing some of them, but a 50% reduction of those that are unsheltered and on the street. I think that's what people voted for, frankly, is one of the top priorities. And I agree with Mayor, if from a strategy, we gotta be chewing gum and walking at the same time, and we need to do SDCs, and we need PSH. What I'd like to see is us come up with, and I haven't had the opportunity to do this in this room, but monitoring the progress of the performance towards goals, ensuring alignment, jurisdictional investment towards the strategies and key performance, adjusting annual goals at the completion of the year, assessing strategies, but we have to have the data to do it, right? Reviewing audits and making sure that we're spending the money properly. Again, this room has not had that opportunity to do it, and I think that's something when I came away from, that's really what I'd like to see. I think this is a great exercise. I still think we need to focus on the goals that are outlined in the 4 measures that were started with the first HRAP. I do like the revision going to a 2.0 because I think it creates a framework that's a little bit more clear and understandable. But I come back to the priority of reduction of those that are unsheltered on the street at 50% is the top priority.
I have lots to say about everything, but I'm keeping my mouth shut by design. Do you want me to respond to that or no? What, Chair?
Yeah, no, I think everybody has had a chance to talk through their things. I mean, I appreciated Ryan's comment when I was going through the exercise. He was like, more red dots. And that was like a really good reminder, because I do think that we are at a point where we need to, especially, and I just will trust this, and you brought it up earlier, Jillian, like in a future where we are looking at reduced resources at federal, at state, at local levels, we have to be prioritizing how we are going to be making these investments, what we are going to be spending our time, energy, and dollars on, and what is going to get us the most impact in reducing unsheltered homelessness and preventing people from entering homelessness in the first place, and moving people into housing and helping them stay housed, right? That is the system work that we have in front of us. And so trying to be as streamlined as possible so that, I think, Peter, to your point, we are using the new data we have, we are updating the goals in a way that makes sense. Like, I feel like the addition of inflow is going to be a really key thing. We did not have the data on inflow when we started this work, and that is showing us that we are right now losing the battle of reducing homelessness because we have, as much work is happening and moving people off the streets into shelter and moving people into housing, more people are coming in. So Mayor, your point about how can we actually interrupt, some of the work of people moving into homelessness, whether that's through prevention or whether it's, like helping them find that connection to their family or friends where they're from. Like, all of that is important work. So keeping that in mind, I really, as staff moves forward, as you're taking in the work of the community advisory committee, as the implementation committee, really, and our input of really looking at how can we streamline this to recognize the system that we want to build with the priorities that we're hearing from folks. So that's what I tried to do, and I did a gold star and a thing of those, like, I think are key to keep in, but most of the other ones is like, how can we streamline and focus on work and less planning and more work.
That's where my mind was, if I may. I walked up there and felt like there were instantly too many greens and too many stars. And the fact that everything seemed to be a priority didn't seem like anything would change. So I put my stars down, and I put the green stickers down, and I only used the red ones for the same reason that you just mentioned. Everything being a priority, being stretched thin in an environment like this, doesn't make sense to me. And so we absolutely, in my mind, have to say what's important, what's priority, and the things that have been nice, the things that make us feel good, the things that we talk about when the meeting is over, are the things that I'm ready to talk about now.
So now the floor is yours, Jill.
Oh, well, I just want to respond to Peter's comment, because I think we're gonna talk about this and actually put a charter in front of you in October. We're just in this weird moment, like our KPIs were set as 2-year KPIs, but you are right, we're supposed to set annual goals. Our current set of KPIs expire at the end of the year. We need new ones. We need a more clear measure one that is not based on old data, but it's based on the new data. So we are gonna start that discussion around outcomes and KPIs next month with the goal of getting it to our respective bodies by the end of the year. So that is to come. And then I just review audits. Know that I am broadly defining audits. I am including, Anna Plum, I don't think this will surprise you, but any evaluation that happens. So there are 3 I'm gonna email you about next week that you need to be aware of that are gonna come to this body. There's an amazing Pathways project underway, which is started following 400 people through the system. They're narrowing it down to 50 people through the system, sort of a quantitative and qualitative. An initial report will be ready this fall with the final in February 2026. There's a shelter evaluation project I think some of you are nominally aware of. I'll get a paragraph description of that scope. That is due by this December, so that when we go into our resource-constrained conversations about our shelter system, elected officials have the information they need to make smart decisions about the continuum that we can invest in going forward. And then there's, HSD also has a rapid rehousing evaluation underway. Anna, I'm not sure the deadline on that one. I meet with Doc next week. But regardless, those 3 are critically important evaluations that will come to this body under that charge. And also, the county auditor is doing another audit of us. So I don't know what the timeline around that one is, but that's also happening, so that would also come here. But we just haven't had any yet to bring you, but yes, we will be doing that.
All right, thank you. Anything else for the discussion?
I could also just paint a picture for like the final work product, Mayor, kind of what I was sharing with you, that part of the refinement that we'll get into next month is also a refinement of our outcomes. Y'all, there's like 8 to 12 outcomes for each of the 9 goal areas right now. That's absurd. So we need your guidance in getting it down to those, 3 or 4. So we're gonna go through the plan, reorganize the outcomes. I could give you a visual. like in this visual, like inserting a column here for those 3 to 4 outcomes, then our categories, and then our KPIs, our new set of KPIs, quite frankly, that align back to the plan. We all know, and there's no fault around this, that our first 4 KPIs were just set in a different time of place among elected official staff, which is great. I'm one of those people. But right now that work is starting with the data and evaluation team, where it should, in terms of what can we measure, and giving that to y'all next month to react to as we reset those KPIs to what we really need going forward, the metrics we want to hold ourselves accountable to. And doing that in this body rather than at a staff. Which again, no blame, but it'll be better. And
Are
it'll
you
be
gonna bring
more
more
what
of
we want.
these?
What?
Are you gonna bring more of these to that meeting?
I'll bring-
We bought a whole box.
Yeah, we've got a big box of red dots. We'll share those around.
Just a quick comment here, and this may exist, but as at least for me, when I think about what we're doing here, one of the things that's missing in my mind, and thus also missing, I think, in the circles that I travel, especially our electeds in Gresham, is the data or the demographics that supports the prioritization. So one of the examples is as I was looking through a lot of the youth stuff over here, I didn't know the context. I don't know how significant the problem is, so I couldn't prioritize it because I just didn't know the demographics. And I also have a leader in Gresham who consistently says, roughly 95 to 99% of all homeless individuals, houseless and unsheltered, are addicted. And those are comments that they're utilizing to drive whatever solution they think we should implement. So again, it may exist somewhere, but I haven't seen it. So it doesn't mean it doesn't exist if I haven't seen it. But would love to have some of that demographic information. What percent of our unsheltered and chronically unsheltered individuals are facing behavioral health challenges. Those types of things, so that at least we can be more informed, and I can inform those folks who I'm accountable to as to why we prioritize, reorganize, and refine what we're working on.
Ryan? Oh, go ahead.
I would just echo that. I think I had added a lot of questions to some of my sticky notes were mostly questions because I didn't feel like I could say one way or the other because I wanted to understand. I'm like, there's missing information from this for me to understand, or I don't have a good sense of again, I asked a question about what's the status currently of the homeless youth continuum. I know there's such an emphasis in our state around youth coming out of foster care. We have a very clearly broken system in that space as well, but we also have a lot of others. So in terms of the prioritization, sort of helping understand, and I know that just anecdotally speaking, more money tends to go into youth services in general. And so, just kind of knowing where those systems are at will help sort of identify the funding, because there's just so much of that too. And not to say again, it's not important, but if we have to make hard pivots and prioritizations, it'd be helpful to kind of get a sense of, where current state is with some of those systems, other systems, and services.
Thank you.
I appreciate both of that, in terms of what information do you need, what is there anything else that folks need or would like to have access to information to help you do this work in this body?
For me, I think I would just like to know some data around folks exiting shelter. Do we have data around folks exiting shelter into permanent supportive housing and not going back into the system, or what the success rate of that is? I think would be helpful for me.
Our Measure 4 speaks to some of that. 85% are still in their PSH unit. Maybe you're asking to dig into that 15% and how much of that 15% we have a return in our system. We should be able to capture that. I'm looking for a head nod from Anna Plum. Returns to houselessness if they have not been successful in a PSH unit.
Yes, we can track that.
Yeah, so, we can do that.
To stay on the topic regarding data, and Chris and Mayor, I know you have experience in data. I've not been involved in an organization like this without outcomes being listed at the front side. And Joey, you sit in our incident command meeting. We start with our key metrics, and we call it the vital few. We don't want a lot, we want a few, and it's hard to come up with them. But I just think it would be best if we could put the outcomes listed and where we're at today and do a look back and look forward on what we have. What are the plans that we're adding? I think we do an awful lot of talking from a bureaucracy standpoint. We have so much firepower in this room to make big swings. And I think it's time we shake things up, but I would really like us to begin with knowing where are we at and what's our goal and what are we gonna do to achieve that goal, right? What are we doing today? What are we doing today to make change to hit the goal tomorrow? I don't think I love what you're doing with the KPIs. I just would like to see a more laser-like approach on outcomes.
And by, just so we're speaking
Sure.
Accurately to one another, when you say outcomes, you do not mean key performance indicators.
Not necessarily. We've got outcomes with shelter beds that we've promised. List them. Where we and what's on deck and what's in prepare. So we can turn to Ryan and Anna and say, what's your plan? What is your 30-day, 60-day? And we can have concrete focus and ask for a results-oriented discussion as opposed to bigger, broader 30,000 feet. I think we need to be down to the ground on those outcomes. And it will help us achieve them because, with all due respect to Anna and Ryan, it puts pressure on the system because you have to answer to an outcome, and then we get to help Anna and Ryan be successful, and then we celebrate the success. Every time a shelter opens or we achieve one, we celebrate it together. We're not putting enough pressure on the system, and we're not celebrating enough the achievements we're having. It's just natural self-actualization. So.
And let's really work on unpackaging that next month because like the shelter goal number to me is an activity. It's not an outcome. So we need to make sure we're talking about the right categories of
And
things,
it's hard
but it's
work.
part of, it can
I
be
get it.
part of that,
Yep.
for sure.
Yep.
Yeah. And I just want to name this. If we were writing a plan from scratch, we would have started up here, KPIs, outcomes, activities, specific action items by category. We're not. We have an existing plan that we are refining. So I am taking you backwards than I think what the normal process is from the bottom up. So you know the work that has been completed or is in progress and working our way back up. So I just want to acknowledge that in normal strategic planning efforts, we would be up here first.
And this is also like, we get the benefit as staff to the homelessness response system to see the conversations at sort of all the levels of oversight and governance that happen here. And we can do a better job for this group in particular in bringing back, like, so when we talk about, and we have our overall KPIs and our goals that we're working toward, then we have action items that are attached to meeting those goals. That conversation about how are we doing with those action items, you know, where do we need extra pressure, where we have barriers that we need to bust through, that happens with Chris and Mike and our colleagues at the implementation committee level in some detail. And so we're constantly working in that process there. We're also asking our community advisory committee, what's going to make a difference from your perspective at the ground level where we're not seeing the outcomes we want? What's going to make that difference and help us shift? And so that sort of circular conversation helps us out a lot in being able to have implementable strategies. A lot of that is less visible in this space than our working through it in those others. So we can, I think, do a better job of helping to elevate some of that. But it's a balance because we also hear that we don't want to get you too far into the weeds. So, you know, we'll live with you in the struggle of that balance.
I think, we've had this conversation before about bringing in some of the work that is happening at the implementation committee and the community advisory committee to this group. And I think what I'm hearing is that as it relates to our ability to meet the goals and the metrics that we have set in this plan, that information is going to be really helpful, I think, for the understanding. I think you guys have all done a really good job of bringing forward some of the very specific goals that we've had, whether it is around, you know, how many people are, you know, the 85% goal of that, looking at areas where we know we are not, when we're talking about like racial equity, for instance, and some of those impacts. Like we have had those conversations in the room. What I'm hearing is like we want to go maybe up a level to really take a look at some of the broader goals and how this work is going into that. And I think using the expertise that we have at this table to really to bring that to bear in terms of like we have to make decisions about these strategies, and then we have to go back to the, you know, jurisdictions on how we're going to fund those things. But like the advice of this group in positioning that, making informed decisions about those goals.
Yep.
Okay. All right, well, I want to thank everyone for their time. Anything else? We really were able to get through a lot of the things. I know we have a much smaller group today because of summer plans and vacations, but I want to thank everybody for the active participation in this meeting. It's important to get together and really use the time that we have with everybody's busy schedules to get all your good thinking for staffs as they're going to be refining this and bringing us back a plan that really, again, reflects the folks who are at this table, the folks who are in the elected positions now, because all those folks look a lot different than when this plan was first created. So I want to really thank the Homeless Response System team. Thank you for everyone who has been involved in helping this happen today, and for the work in incorporating the feedback that this group has given today. We'll look forward to those to that, and then incorporating the feedback from the implementation and the Community Advisory Committee as well. I know that I want to thank all the staff from both the city and the county and other partners who were here today to help provide the subject matter expertise as we were doing our work and getting some questions answered. We are going to be meeting in August, so we'll be meeting again on August 22nd. It'll from 9:30 to 11:30. We're still deciding a location. Maybe we'll go back out to East County. We'll see.
We'd love to have
The mayor has put it
But I appreciate that. Any closing words, Jillian?
No, this is fantastic and helpful, and I just really appreciate it because we need focus. We do.
So I do have some closing comments. So based on the front end of this conversation, I wanted to voice my concerns again, and I think this is the appropriate time. I want to just kind of level set. So I want to go back to I don't mind having these conversations, so long as we provide it in a limited amount of time, but we spend the 2 hours and we talk about concrete changes that we're going to make today. What are we going to do to hit HRAP 1.0? I'm not ready to admit that 1.0 has failed. If we don't hit the 1,000 beds and have been clear for 8 months, we made a promise to the community. We must deliver on that promise. And the city of Portland is with us to provide other resources. Our council has stepped up and is funded with tens of millions of dollars to help county and Portland change the direction of our city. We have 166 days before December 31st. I appreciate this effort. I think it's important, but I think it needs to work in parallel focus on the crisis on the street. I want to give you an understanding, and every time we have this meeting, I share with you a story that comes into my office. And recently, we had a person die on the streets of Portland, found behind a dumpster, riddled with maggots. This is more important than a conversation. This is about immediate, about action. We have to shake things up. When I go into my office, I close the doors and I cry. I want you to understand this isn't about an exercise. This is about us collectively bringing the firepower to supercharge these efforts in our city now. HRAP 1.0 is still our focus, and I'm going to continue to focus on that in this meeting. I'll make any changes, and I'm not going anywhere. I brought up the last 2 meetings about guidelines. We have people stuck in our existing system. We need to unstick that. Let's talk about that. I'd like to clearly focus right now. I want to bring up reunification and review the guidelines for county, try and match them with the city so we speak with one voice as opposed to going different directions with our organizations, but bring it together to unstick the system. I want that to be brought forward on the agenda. I respectfully ask Jillian and Chair that we bring it forward and we look at our systems. We brought in the group 3 months ago to do that. Portland is here to help. We outlined what our 6 key goals were last time. Let's bring that forward and let's talk about how we can supercharge the system writ large. So thank you, Chair.
Thank you,
Jillian.
Thank you. Appreciate that. All right, lots of good work and we will see folks in August. Have a safe and happy summer until then. Thank you.